Hello, class. I will now talk about Chapter 2, Categories of Health Services. So in this chapter, it provides an overview of the different types of health-related services that are offered in this country, the types of facilities that you can work at, and really how services are organized in this country. So to start off, the overview of the healthcare system, everything essentially falls under the U.S. Department of Health and Human Services, or HHS. There are a variety of programs covered that fall under this department, this federal department of the government. So it's important to identify what those organizations are. There are 4 different types of healthcare services. There's health promotion, which is essentially what it sounds like, promoting the health of populations. So it's not necessarily trying to treat anything, but how can we promote well-being? Disease prevention is specifically around preventing specific diseases. So whether that is health education on how to prevent diabetes or vaccinations on preventing cancer, right? These are the different things that would fall under this category. There's diagnosis and treatment of illnesses, and this is what folks are most commonly aware of. You go to the doctor when you are sick and they fix you and you're good, right? And so that's what a lot of folks know with regards to health services, but there are things beyond that. And then lastly, rehabilitation. So whether an individual has encountered has been injured, or if they have a disability, rehabilitation focuses on maximizing their quality of life and getting them back to a state in which they can function. With regards to healthcare facilities, most people are aware of hospitals. Hospitals are the largest employer of people in the health field, but they really make up about 40% of folks who work in the field. There are also clinics and ambulatory healthcare services which are outside of the hospital. And so there are plenty of jobs that take place outside of the hospital setting. Another important thing to take note of are mental health services. So previously, people who were not mentally well were institutionalized, and it was seen as more of protecting everyone else rather than trying to help the patient themselves. And so with this shift to treating mental illnesses, there are a lot more services that are being offered, and particularly with the Parity Act of 2008, that ensures that patients can receive mental services as much as physical services. Additionally, there's the Patient Care Partnership, which was developed in 2003, which is really about making sure that patients are really at the center and protected. And then lastly, there's public health services. So this is not for any particular individual, but really looking at the population's health. What are the different ways that we can create communities that promote health and well-being, prevent disease, and ensure that we have a healthy country. So I would encourage you to read the text in more depth to get a better understanding of each of these aspects. There are a lot of historical highlights. There are a lot of different departments in HHS, and these will all be helpful in navigating the space as a health professional.